Osteoporosis is a bone disease that is associated with low bone strength and an increased risk of fracture. There are a number of strategies that are used to prevent fractures. The first thing is to assess your risk. So we want to assess risk factors for bone loss or for fractures. And then if someone is thought to have some risk factors, they can be sent for a bone mineral density scan to assess their bone strength. The next is to recommend medication for people who are at increased risk of fractures. And there's a number of different types of medications that people can try. And also to ensure that they're getting adequate calcium intake and adequate vitamin D. And finally, we also want to do exercise and fall prevention. So the number one cause of hospitalization in older adults is falls, and many falls cause fractures of the hip, of the spine, of the wrist. And so if we can prevent falls, we can prevent fractures. And one of the best ways to do that is with exercise. So exercise has been shown to prevent falls in older adults. Some types of exercise may also increase bone mineral density. So it can prevent fractures both by preventing falls and potentially having an impact on bone strength.
I say T4, but I'm like a T4, T5 paraplegia Asia complete. I just in the end of July 29th, I just 14 years since my injury.
Ed's been coming to see us for, I think, probably the better part of 10 years. It was a handful of years after his accident. He's been working on strength training and transfer training and improving his overall function. He had a fracture of his lower leg before he'd seen us, and one of his goals when he came to see us was to improve his transfers and lower the risk of him falling again.
I was 200 pounds. I have a Dodge Caravan, modified with a ramp and everything, captain's chair, which means it turns where I can drive. So I was doing a transfer from this chair to the captain's chair, and I don't think I pivoted well enough, or my head was too forward, and I fell within the van, which was no more than 4 feet by 4 feet. And this foot got locked in, and I twisted it around, and I broke my leg within the van. I didn't even know it was broken until 3 days later, until my wife said, "Why is your ankle swollen?" And then that's when I went to the fracture clinic, and they go, "Yeah, you have a hairline fracture." And I couldn't move out of bed for 6 months because my bones were too brittle. So they couldn't cast me, they couldn't screw me, they couldn't do anything. So I just, no weight, and just lay in bed for 6 months.
With a spinal cord injury, there are additional risk factors for fractures that are slightly different than in people who do not have a spinal cord injury. So for example, having a motor complete injury, or having tetraplegia or quadriplegia, or being a woman who's over 50 and has been at least 10 years post-injury. Those are some examples of risk factors that are specific to people with spinal cord injury. There's also certain medications that are used more commonly in spinal cord injury that can increase the risk of fracture. So it's really important to talk to your doctor about your risk factors. And also really important that we do some research to get the knowledge around those risk factors out there.
I've learned that posture is important. I've learned that time, don't rush it. Make sure that your contacts are correct, and that you're confident when you're doing the transfers. Don't have any hesitation. Have faith in yourself that you're going to be able to do the transfers.
His successes have been amazing. I've watched him go from improving just his level transfers, so transferring in and out of the chair onto a level surface that's even, to, a floor to chair transfer. So he can lower himself down onto the floor and get himself right back up into his wheelchair. His balance in sitting is a lot better, so more improved. So what he's done is lowered his risk for a fall during a transfer. And that's how we indirectly target his bone health. Although his legs aren't working, what we can do is improve the environment and lower the risk of a fall during any of those functional movements like transfers.